First of all, non-compliant patients, keeping appointments, taking medication, just keeping track of not only seeing the patient, but trying to keep up with what they're doing and making sure that we got the proper records on them. Mm-hmm. That's extremely hard in family practice. Right. The other thing is now no insurance, no transportation. Other things are coming into play that makes it even harder. For approximately 9 months, we researched EMR systems, and during that 9 months, we involved physicians in the research committee. We looked at several systems and narrowed it down to 2. Prima was the one that actually the physicians chose to be the most friendly and user-friendly. Mm-hmm. Well, one of the major things we were looking at is to be able to get the reports we needed. We are in a rural area. We are a rural health site. That means you want to track things. We were unable to do that previously. That was very important to us. So Prima had that to offer to us. The other thing was keeping track of our patients too, to be able to report back to them, make calls to them. And in the size practice we had become, it was impossible to do that anymore. Prima showed us they could do all of that for us. One was to be able to get the chart in our hand. This was becoming an increasing problem in our office. We could not locate the charts half the time. And when we did locate the charts, maybe the last documentation had not been recorded in it. Sometimes you did not have correct instructions on the medication the doctor had prescribed, and all that was becoming an increased problem for us. Some of the things we really like about the PM is, of course, the reporting part of it. The other thing is electronic posting of insurance payments, no longer having to go through files and files of EOBs to refile something. Everything is at our fingertips now. Patient billing, much easier to understand. So all the PM part we liked.
Excellent. And I would imagine that the cycle of payments has probably gotten a little quicker.
Much better.
Right?
It's quicker, we have a much better turnaround because we're billing, we don't wait until a 30-day cycle, we're billing instantly. Okay. First of all, I'd like to say that I feel very good about it because Prima's doing the homework. They've got it ready for us, and that's very enlightening to see that it's a matter of us turning on the buttons and doing the work. Prima's going to do the recording for us, which is going to be great. So I'm not worried about it at all. We're going to qualify.
Excellent, excellent. Yeah. And that's that's not only for the meaningful use requirements, but for the stimulant.
Right.
Right?
Yeah.
Excellent.
Well, first of all, I would say to any practice, make sure your doctors are involved in the selection because they become a part of the team. It's something they wanted and they helped choose it. Every other time we've chosen anything in technology, management has done the choosing and made it work. We made the doctors a part of the choosing, and then the training was so important, and we made it so that every doctor, every staff member had to sign up for the training. And I would suggest that to anybody. Don't let your doctor slide through without that training. It was very important, and the fact that we went through the training, the go live date when we turned the switch was nothing compared to what I was expecting. Everything went great. And we were busy practice. We only cut our patients back 10% the go live date. So all the stories I had heard, you got to cut it back 50%, that scares doctors. No, you don't have to. If you do your homework and you're ready, you can do it. Good teamwork, all the nurses, like I said, everybody was pedaling the bicycle the same way. And that was what was important.